Hello, everyone, and welcome back to the Mr. Jobs English podcast. We're so happy to have you here with us again. I'm Mia.
And I'm James, right here with her, ready for another great conversation. If you're joining us for the first time, this is where we explore real professions, real vocabulary, and real English through natural conversations.
And today we're diving into a profession that is loved in both Canada and the United States. A profession full of compassion, responsibility, science, and sometimes a little chaos. We're talking about the veterinarian.
Oh yeah, vets are heroes. I mean, they handle everything from tiny kittens to huge dogs, from talking nervous pet owners down to performing surgeries. They do it all.
And they do it with patience. So much patience. One thing I learned in Canada is that a vet's day is never predictable. One moment you're doing a simple checkup, and the next you're diagnosing a strange noise a dog makes when it gets too excited.
That is so true in the U.S. too. And vets also deal with farms sometimes, especially in rural areas. Horses, cows, goats, big patients, big problems, big responsibilities.
Before we get too excited, let's start introducing some vocabulary the natural way. One of the essential tools every veterinarian uses is the stethoscope. It's the classic medical tool to listen to a pet's heartbeat or breathing. When a vet says, "I'm going to check the heart," they usually put the stethoscope on the pet's chest.
And right next to that, another important word is examination table, which is just the table where the pet sits during the checkup. Simple, but essential. And it's funny because many pets hate that table. Dogs start shaking, cats look like they're planning an escape.
Yes, cats especially. And that brings us to a verb vets use all the time, to restrain. It means to gently hold an animal so it doesn't move too much. Very important for safety. You can't exactly tell a scared cat, "Hey, please stay still for a second."
You definitely cannot. And another word that shows up all the time is vaccination. That's when the vet gives a shot to protect an animal from diseases. And the action itself is the verb to vaccinate. For example, "We need to vaccinate your puppy today."
And owners always react the same way. Will it hurt? Yes, a little, but it's quick.
And then there are the funnier situations. Levels of drama depend on the animal. Chihuahuas scream like they're in a movie. Golden retrievers don't even notice.
Speaking of drama, another key vocabulary word is symptoms, signs that something is wrong. The vet usually asks the owner, "What symptoms did you notice?" Maybe loss of appetite, vomiting, scratching too much, limping?
Or eating something they should not eat, like socks, rocks, remote controls, half of the couch.
Dogs are adventurous, and that's why veterinarians need diagnostic tools too, like x-rays or the verb to take an x-ray when they need to check bones or objects inside the animal.
And another common thing is blood test. The verb is to draw blood, when the vet collects a small sample of blood to check the animal's health. Many owners get nervous watching this.
Sometimes the owners are more scared than the pets. And I think now is a good moment to add a little story, something natural, like what could happen in a veterinary clinic.
Oh, go for it.
So imagine this. A vet in Canada is in the middle of a regular morning. She has her stethoscope around her neck, her examination table ready. She's organized. She thinks the day will be simple. Then a man arrives with his dog, a big fluffy one, and says, "My dog is making a strange noise." The vet listens with the stethoscope and hears nothing strange. She checks the dog's temperature using a digital thermometer. Everything normal. So she says, "Can you describe the noise?" And the owner says, "Sure, it goes like this." And then he makes the weirdest sound in the middle of the clinic.
Oh no, that must have been awkward.
Very. Everyone looked at him. And then the dog, hearing the sound, starts making the same sound. Turns out the noise wasn't a symptom, it was just the dog copying his owner.
That is amazing. Dogs are funny. And that brings in another important word for vets, behavior, meaning how the animal acts. Sometimes a problem is not physical, but behavioral, and the vet needs to observe that.
Right. They don't only check the body, they check behavior, routine, diet, which is another great word. Diet, meaning what the pet eats every day. Vets often recommend a special diet for overweight pets or those with allergies.
Speaking of allergies, another important vocabulary term is skin irritation. Many pets come to the vet with itchy skin, red spots, or allergies. And the verb to prescribe appears a lot because the vet prescribes medications, creams, or treatments.
A very common one is antibiotics, medicine to fight infections. So a vet might say, I will prescribe antibiotics for your dog. And then they also explain instructions like, give one pill twice a day.
And speaking of pills, we have the verb to administer, meaning to give medicine to the animal. Some owners are great at this, others not so much.
Oh, yes. Some cats turn into ninjas when it's time for medicine. They disappear.
That's when vets talk about techniques. They show owners how to safely hold the animal to administer the pill or liquid medicine.
Another interesting part of a veterinarian's job is surgery. So vocabulary like surgical tools, anesthesia, and to operate appear. For example, the vet needs to operate to remove the object the dog swallowed.
And anesthesia is the medicine that puts the animal to sleep during the surgery so it doesn't feel pain.
Exactly, but not all days involve surgery. Many days are simple checkups, which reminds me, checkup is another essential word. A checkup is a routine visit to see if everything is okay.
And after the checkup, vets usually give advice, meaning helpful recommendations to the owner.
And because vets communicate with humans and animals, they need patience and clarity. Sometimes they even deal with anxious owners. The word anxious is helpful for learners. It means nervous or worried.
And not just owners, animals can be anxious too. Some pets shake, hide, or try to escape the examination table.
And that brings us to another term, to calm down. Vets often try to calm down the animal before doing something stressful.
So as we continue this conversation, remember, veterinarians do much more than treat animals. They also comfort humans, solve mysteries, and sometimes play detective.
That's true, and it shows how rich the vocabulary around this profession is. Tools, actions, emotions, medical terms, it's all part of their daily routine. So, James, something I always notice when I visit veterinary clinics in Canada is how organized the environment feels. There's always that soft smell of disinfectant, shelves full of medicine bottles, charts hanging on the walls, and the sounds of pets making all kinds of noises. It's a whole world of its own.
Oh yeah, that's very similar in the US. And the moment you walk in, there's always someone at the front desk asking for your pet's information. That's another useful vocabulary word, patient file. It's basically a record with everything about the animal. Vaccinations, past illnesses, allergies, treatments. Vets depend on patient files a lot.
They do. And another word learners should pay attention to is clinic assistant. These are the people who help the veterinarian prepare tools, clean equipment, hold animals during procedures, and communicate with pet owners. They're essential.
For sure. And speaking of tools, I love when students learn the word syringe. It's the instrument used to give shots. The action is to inject, like the vet injected the medicine into the dog's leg. Simple, clean English.
And you know what's funny? Even though vets use syringes every day, many pets act like it's the end of the world. a tiny injection, and suddenly the entire room becomes dramatic.
Totally. And that leads to another great verb, to examine. The vet always examines the animal before deciding anything. They look at the eyes, ears, fur, teeth. The ear examination is always a challenge because pets don't like things going near their ears.
Especially cats. They look betrayed. And while we're on vocabulary, let's bring in heartbeat and breathing rate. Vets measure those to understand how the animal is doing. If the heartbeat is too fast or too slow, it can indicate stress, fear, or a health problem.
And then there's the classic word temperature and the action to take the temperature. Many people don't know that veterinarians usually take a pet's temperature rectally, which is why the pet looks at the owner like, "Why have you allowed this?"
Poor pets. But it's a routine procedure. And another big one is diagnosis. That's the conclusion the vet gives after examining the animal. They might say, my diagnosis is an infection, or the diagnosis is a food allergy.
Speaking of allergies, another extremely common term in vet clinics is flea treatment. Fleas are a nightmare. They're tiny insects that bite animals, and the vet often recommends a monthly treatment to prevent them. The verb is to treat, like, we need to treat your cat for fleas.
And dogs, too. And then pet owners suddenly discover the meaning of itching because the animal scratches nonstop. The vet might ask, how long has your dog been itching?
And once the vet knows the diagnosis, they usually explain the treatment plan. That's a great expression. It means the full strategy to solve the problem. Medicine, checkups, diet changes, follow-up.
Which reminds me, follow-up appointment is also very useful vocabulary. It's the next visit to see if the treatment is working. Vets almost always schedule a follow-up.
Definitely. And we should bring in to monitor, which means to observe carefully over time. The vet might say, we need to monitor your cat's condition for the next 2 days.
And sometimes they need more advanced tools, like an ultrasound machine. It uses sound waves to see inside the body, super useful for pregnancy checks or internal problems.
You know what's interesting? In both the US and Canada, many vets also work with animal shelters. That's where abandoned animals stay until they find a new home. Vets do checkups, vaccinations, and sometimes surgeries for shelter animals.
Yes, and that brings us to a very emotional and important word, adoption. When someone chooses to bring a shelter animal home, that's adoption. So sometimes vets help guide people during the adoption process, giving advice about the animal's personality, needs, and medical history.
And personality is important. For example, when a vet describes a dog as friendly, shy, energetic, or aggressive, those are useful adjectives for talking about pet behavior.
Absolutely. And that brings me to another term, to socialize, meaning to help a pet interact better with people or other animals. Vets sometimes recommend socialization when a dog is too nervous or reactive.
Pets can be dramatic when nervous, which leads to another important phrase for students, to comfort the animal. Vets, often pet, talk softly or speak calmly to help the animal relax.
And they do that with owners too, especially during emotional moments. One of the hardest parts of being a veterinarian is dealing with pain, sickness, or loss. But it's also one of the most meaningful parts of the job.
Yes, vets have to communicate with a lot of empathy. Empathy is understanding and sharing someone's feelings, like when an owner is worried and the vet explains things gently.
One time in Canada, I saw a vet comforting a little girl because her hamster needed surgery. The vet explained everything with such kindness, and the girl calmed down so fast. The power of communication.
And that reminds me of another vocabulary word, procedure. It's any medical action the vet performs, a dental cleaning, a vaccination, a blood test. The vet might say, "This procedure is quick," or "We need to prepare for the procedure."
Speaking of preparing, sterilization is another very common term. It means cleaning tools to kill bacteria. Everything must be sterilized in a clinic. Tools, surfaces, surgical equipment.
And also to disinfect, meaning to clean using a disinfectant. Vets disinfect the examination table between patients.
Now I'm thinking about how many verbs veterinarians use every day: to observe, to analyze, to detect, to recommend, to treat, to operate. It's a rich vocabulary field.
And we haven't even talked about emergencies yet. A very useful expression is emergency visit, when the pet needs attention right away, like when a dog eats chocolate. Not good.
Extremely dangerous. Chocolate is toxic for dogs, and that connects with the word poisoning, which means the animal ate something harmful. Vets need to act quickly in those cases.
There's also to stabilize the patient, meaning to keep the animal safe until they can continue treatment.
And sometimes they use an IV, which means intravenous therapy, basically giving fluids directly into the vein. The vet might say, "We'll put your dog on IV fluids."
It looks serious, but it's actually very common in clinics.
Now, maybe we can bring in another natural moment, something that shows how vocabulary appears in real life.
Go ahead.
Imagine a vet working on a Saturday morning. She has her patient files organized, her stethoscope around her neck, and she's cleaning the examination table after disinfecting it. Suddenly, a man runs in with a cat inside a carrier. He says, "My cat swallowed something," and he looks pale. The vet opens the carrier, examines the cat, and asks about symptoms. The man says, "He's been vomiting and hiding under the bed." Classic signs of discomfort. The vet uses her stethoscope, checks the heartbeat, and doesn't hear anything alarming. But she says she wants to take an x-ray just to be sure. When the x-ray comes back, she sees a small toy stuck inside the cat.
Oh no!
The owner looks shocked and says, "But that toy disappeared a year ago."
Cats really are magical creatures.
The vet explains the treatment plan calmly. The cat needs a small procedure to remove the toy, anesthesia will be used, and a follow-up will be needed. The owner nods, relieved that it's treatable, and everything ends well.
That's such a typical situation, and it uses so many words students need.
And all of this shows something important. Veterinarians mix science, communication, organization, and empathy in every part of their day.
Yes, and as we continue talking about this profession, we'll naturally bring even more vocabulary into the conversation.
Absolutely. There's still a lot to explore, from daily routines to complex situations, from simple tools to advanced procedures, and from calm pets to very energetic ones. You know, James, something I always notice when visiting a veterinary clinic is how calm the good veterinarians stay, even when everything around them is loud and chaotic. Last week, I saw a tiny dog barking like it was about to make an entire revolution, and the veterinarian just kept talking softly, checking the dog's paws, and explaining everything to the owner like nothing unusual was happening.
That's such a perfect description of real veterinary energy. They deal with barking, meowing, screaming parrots, worried owners, emergencies, and a full schedule, but their voice stays calm, slow, and reassuring. That's why the vocabulary around this profession often uses words like gentle, steady hands, comfort, and reassure. When a veterinarian reassures a pet owner, it means they help them feel calmer and more confident by explaining what's happening in simple language.
Exactly. And it's amazing how veterinarians are also great communicators. They don't just treat animals, they guide the humans. They say things like, "Let me walk you through this," or "Here's what we're going to do." Those expressions are friendly, simple, and very helpful for English learners. And you hear them all the time in veterinary clinics.
Speaking of hearing things all the time, one phrase that really belongs to veterinarians is, let's take a closer look. That's such a classic. Whether they're examining a cat's ear or checking a dog's heartbeat, they say it with that calm, steady tone. And learners can use that phrase in other daily situations too, like checking a problem on a laptop, reading a document, anything that requires careful attention.
That reminds me of a moment from our little story earlier, when Dr. Andrews said, "Let's take a closer look at Buddy." That simple sentence made the owner relax because it meant the veterinarian was taking control of the situation. And Buddy, even though he was nervous, immediately stopped moving so much when she touched him gently. Animals really feel the difference when someone knows what they're doing.
And another powerful veterinary phrase is, no worries, we'll figure it out. It's reassuring, friendly, and very common in clinics across the US and Canada. I've heard it from veterinarians more times than I can count. It's a short, sweet way to say, don't be stressed, we will solve this. And learners love these kinds of phrases because they sound natural, not robotic.
Speaking of natural, the work environment of a veterinarian sometimes looks like a busy classroom, a small hospital, and a zoo all combined. You see dogs pulling their owners, cats and carriers giving that "I'm planning my escape" face, birds covered with towels so they don't flap around, and sometimes even rabbits or turtles. And in the middle of all that chaos, the veterinarian moves with purpose.
Absolutely. The tools are also interesting. A stethoscope, thermometer, syringe, nail clipper, bandage, scale, medical chart. And each one has simple explanations. A stethoscope is what the veterinarian uses to listen to the animal's heartbeat and breathing. A syringe is used for vaccines or medicine. A medical chart is the record where the veterinarian writes the pet's health information. It's very similar to human medicine, but adapted to different species.
And the actions are important too. A veterinarian examines, checks, measures, diagnoses, treats, prescribes, and sometimes performs surgery. And each action has a simple explanation that English learners can understand easily. For example, to diagnose means to find out what the problem is, and to treat means to give medicine or do something to help the animal get better.
One thing I love is that veterinarians always explain what they're doing while they're doing it. They say things like, I'm checking his eyes, I'm listening to her breathing, I'm going to clean the wound, or I'm giving him an injection. That's great language practice. It's clear, simple, and useful in so many real-life situations.
And this brings us to a nice moment that happened in our story earlier when Dr. Andrews said, "Let's give her a moment." I love that. It's one of those phrases that shows competence and emotional intelligence at the same time. And English learners can use that expression in daily life too, when someone needs time to think, calm down, or relax.
There's also cultural differences between clinics in Canada and the US. In the US, some clinics are very fast-paced with quick appointments, while in Canada, it's common to see veterinarians spend just a little more time talking and explaining things in detail. Not a huge difference, but noticeable. Canadians love giving context and reassuring people.
Yeah, we do. But in both countries, you'll find the same warmth when it comes to pets. People really love their animals, and veterinarians know that. So their language is always polite, soft, and supportive. For example, when giving instructions, they say things like, make sure he drinks plenty of water, try to keep her calm, or give this medicine twice a day. Short, direct sentences that are easy to understand.
Let's jump back into the world inside the clinic for a moment. Imagine Dr. Andrews is now checking a rabbit that has been chewing on everything, including the owner's backpack. The owner is embarrassed and the rabbit is wiggling non-stop. Dr. Andrews holds the rabbit gently, places it on a towel, and says, "You're full of energy today, aren't you?" And the owner laughs because the veterinarian turned a stressful situation into a friendly moment. Then she explains, "He might be chewing because he's bored or anxious. Let's check his teeth and see if everything looks normal." That's the kind of natural English our listeners can absorb without even realizing they're learning new vocabulary.
And I love how veterinarians use simple metaphors to help owners understand things. They might say things like, "This medicine works like a shield," or "Think of this cone as a little safety helmet." That helps owners visualize the idea. And for English learners, metaphors make vocabulary easier to remember.
Another interesting aspect is how veterinarians give instructions after the appointment. They say things like, "Keep an eye on him," which means to watch him carefully, or "If anything changes, give us a call," or "She should feel better in a couple of days." These are everyday expressions that make you sound more natural in English.
And the emotional side is strong too. People cry in veterinary clinics, sometimes from stress, sometimes from fear, sometimes even from relief. And veterinarians handle that with so much compassion. They say things like, "You're doing a great job," or "She's lucky to have you," or "Let's take this one step at a time." Those short sentences help people breathe again.
I think that's something powerful for our listeners to understand. Learning job-related English isn't only about tools and actions, it's also about the emotional tone. Veterinarians speak with kindness, patience, and clarity. Their English reflects that. And when learners use similar vocabulary, they immediately sound more gentle and confident.
One thing I always find adorable is when a veterinarian talks directly to the animal, even though they know the pet can't answer. They say, "You're okay. Good girl. Almost done. You're so brave. And in there, buddy." And funnily enough, the owners also relax because of those words. They feel comforted just by hearing that soft tone.
And those simple phrases are great for English learners. Short, friendly, emotional language is easier to understand and easier to use, and it helps them build confidence fast.
Before we wrap up today's episode, let's revisit a few essential veterinarian expressions one more time in a natural way. When you hear "let's take a closer look," you know the professional is about to examine something carefully. When a veterinarian says, "Let's keep her calm," it's about controlling the environment to help the animal feel safe. And when they say, "We'll figure it out," that's the perfect mix of confidence and compassion.
And during the examination, sentences like, "I'm checking his breathing," "I'm looking at her teeth," or "I'm giving him his vaccine" are amazing examples of simple action English. Anyone can learn from those.
And, of course, the classic comforting phrases, "You're doing great," "She'll be okay," and "Give us a call if you need anything."
It all paints a full picture of what veterinarians do, how they talk, and how their English sounds in real life. And that's exactly why this profession is so rich for language learning.
This was such a warm and fun episode to record. I feel like I just spent an afternoon in a clinic hugging every dog and cat.
Same here.
And to everyone listening, thank you for spending this time with us.
If you enjoyed today's episode, follow the podcast, hit the like button, and tell us in the comments which profession you want us to talk about next.
We'll see you next time.
Take care, everyone. Bye.
Bye.